Hi Jenny. Today I wanted to talk to you about the medication that you were just prescribed by Dr. Olson. I know that this is new for you. You've never taken an antidepressant before. Dr. Olson prescribed you citalopram. You're starting out at 20 milligrams, which is a very common starting point for citalopram. The largest dosage that is effective for people with depression is 40 milligrams, but sometimes clients or patients of doctors do take up to 60 milligrams. Citalopram is also called sometimes Celexa. You might hear both names. And this medication is to help your feelings of sadness and depression. It's also going to help those times that you feel anxious. And I know that that happens a lot. Because one of your biggest symptoms of depression is that you like to sleep in late. You're going to be taking the citalopram at night, the medicine at night, and that's going to help you sleep, and it's an extended release, so it's going to work throughout the next day and hopefully help you wake up a little bit earlier than you have been. Some of the ways that your doctor and I and those around you will know that the medicine is working is that in 1 to 4 weeks you should start to have more energy and see an increase or an improvement in your mood. I want you to be honest with me. I'm here to support you and help you and listen to you. It's my job to be aware of what the side effects are that you're having and to help relay that information or share with Dr. Olson what kinds of side effects you might be having that are negative especially. So some of the negative side effects that you might experience are nausea, dizziness, an upset stomach, loss of an appetite, changes in your sexual abilities. Also, a lot of people do have a dry mouth when they first start taking a medication like an antidepressant. Also tremors or shakiness. I want you to be mindful of that and kind of keep track of how you feel and when you feel it. Sometimes doctors have to make a change in the amount of medicine that you're receiving. And some people, even after the 4 weeks or 6 weeks, don't start to notice a huge difference in their mood or their feelings. And so some people do need to take more than one medication, and that's totally normal as well. Other common signs might be insomnia or forgetfulness, weight gain. Those again are all normal side effects, but to you they might be negative. The most important thing that I want you to share with me is if you start to feel more depressed after the first 6 weeks or month on the medication. We have this thing called a black box warning, and I really need to know if you're feeling more depressed, having feelings of suicide, wanting to end your life, if you're wanting to hurt yourself or hurt others. These are signs that Dr. Olson and I need to know right away. We've scheduled a follow-up appointment for you after the first 6 weeks or after a month taking the medication, and that is so you can communicate with Dr. Olson how you're feeling. After that point, you'll probably have checkup appointments maybe every 2 months or every 3 months. And I want you to know that some people are able to stop taking medication at a certain point. Their depression gets better and they don't need the medication any longer. So I know you're hesitant and you're nervous about this and how it's going to affect your body. It's not something that you necessarily have to take for the rest of your life. If you want me to sit in on that appointment with you, with Dr. Olson, the first checkup, I'd be happy to do so. Again, I'm kind of your cheerleader and your advocate in taking this medication. I'm here to kind of be a soundboard and remind you to take your medicine and really hear about those side effects that you might have. Citalopram is an SSRI, so there's lots of different types of antidepressants. couple different classes or types. And an SSRI is a medication that helps really neurons in your brain, in the cells of your brain. It helps messages be properly translated from one cell to the other. Again, so that we boost and increase or improve that mood. So I have just a little diagram. What citalopram does is it blocks the reuptake channels. So the serotonin, it's a chemical in your brain. So the serotonin doesn't go back to the first cell. Instead, it hangs out in this gap so that improvement of mood and energy can happen. So it allows the serotonin to kind of just hang out. So I have this really cool drawing. So this first cell is where the serotonin or that chemical is leaving, and we want it to travel to the next cell. But with a person with depression like yourself, what happens is it doesn't travel naturally. So you need the help of that citalopram. So instead of the serotonin, that's those little dots in this picture, instead of the serotonin reabsorbing back into the first cell, we kind of want the serotonin to be released and hang out here. And so that is what the medication is going to do. It's going to allow the serotonin to hang out a little bit longer, and then hopefully be absorbed into the next cell. So again, the medicine helps to do that, helps to make it travel or flow to the next cell more efficiently and better. Again, there's different types of medications and they impact different chemicals, but citalopram is an SSRI, and so it's really focused on helping the serotonin chemical in your brain. I know that sounds really confusing, and I'm going to give you this picture if you want to remember what it is that the medicine is doing. Also, you have that insert in the medication that you got from the pharmacy, and that has just more information about the side effects and what you should be experiencing and the dosage. Also, look on your bottle. You can remember that you're taking the 20 milligrams, and it has the instructions for taking the 1 tablet at night. And it has also the pharmacy name and phone number and address, also your prescription number for doing refills after this first bottle is up. So Jenny, if you have any questions at any time, you know you can call me, you can call Dr. Olson. Also, I know your medical doctor knows that you're taking this new medication. And so we are all a team, and we are here to help you. Your family and your friends, you can share with them that you're on medication, or you cannot share that you're on medication. That's totally up to you. We're gonna protect your confidentiality and not share that information with anybody. But as supports in your life, maybe you want to share that information with them so that if they start to notice side effects, they too can call me or call Dr. Olson as well. So this is for you, and if you have any follow-up questions, again, please feel free to call me or Dr. Olson, and I'll be seeing you probably next week or in a couple of days. Thanks, Jenny.